Before the break, we told you the retail price for a standard power wheelchair. In most medical supply centers across the country, you'll pay about $1,000 for it. But the cost for taxpayers, when Medicare is involved, the price quadruples to around $4,000. Same chair. William Lajeunesse is tracking your taxes. He's live for us in Los Angeles. $4,000 for a $1,000 chair.
Well, Trace, this story helps explain why people are suspicious of promises in Washington of more care for, better care for more people at the same price or even lower. And the lesson comes from the last administration when it tried to cut the fat and stop overpayments in the $8 billion a year medical equipment business. Basically, Medicare tried to stop its archaic fee schedule-based pricing system to competitive bidding. And yet when they did that, Congress stepped in to protect industry over taxpayers.
Reducing the waste and inefficiency in Medicare and Medicaid will pay for most of this plan.
No one doubts Medicare is bloated by waste and fraud, but is there really enough fat for the president's $900 billion health care plan?
You can put me in the skeptical column.
Skeptical because Mike Leavitt oversaw the Bush effort to reduce Medicare expenses by requiring competitive bidding on medical equipment to eliminate overcharging on items like these. Over $7,000 to rent a home oxygen tank, purchase price $600. Over $4,000 for a standard wheelchair versus just over $1,000 in the private sector. Almost $2,000 for a hospital bed, internet price just over $1,000. More than $3,300 for a respiratory pump. On the web, under $2,000. And $82 for diabetic supplies instead of $47 on the internet.
Give me a deep breath.
Auditors say applied nationwide competitive bidding would have saved Medicare $1 billion annually. But Congress, the so-called guardian of our taxes, postponed it after heavy lobbying by industry.
Whenever there is an effort put forward to actually make an efficiency, someone goes on the offensive and hires lobbyists and does what they can to constrain Congress from doing it.
Now we continue to pay those inflated prices. Medicare will once again try to institute competitive bidding, albeit in only 9 cities, Trace. But 30 to 70% savings would be nice. But this story again is emblematic of how difficult it is to really realize the, quote, savings in the waste, fraud, and abuse in the program.